Yeah, so the research I presented at CROI this year was related to a study I did in Kampala, Uganda. So we were interested in looking at drug penetration into female genital tissues of women who were using DMPA as a hormonal contraception. We know that DMPA can increase women's risk of getting HIV. There was some in vitro data suggesting that DMPA may also decrease the phosphorylation of tenofovir to its active metabolite. So we were concerned that now we were setting up a situation where women were at increased risk of getting HIV and also maybe at increased risk of drug failure for oral PrEP. So we did a study where we looked at drug concentrations of the active metabolites of tenofovir as well as lamivudine in cervical tissues, and we actually saw concentrations were higher in DMPA users. So the take-home message was that women using DMPA can feel confident that the DMPA use is not compromising their PrEP efficacy. The other interesting finding that we had was this is really the first data to look at lamivudine concentrations in the female genital tract, and there's a big interest on a global scale for possibly using TDF lamivudine for PrEP, even though the only drug so far that's been studied for that is tenofovir with emtricitabine. So this was the first data that was generated looking at can we use lamivudine in place of emtricitabine for PrEP, and we saw pretty comparable concentrations. So from a pharmacokinetic standpoint, it could be worth looking more into lamivudine for oral PrEP.